Yeah, who owns the medical record is a pretty simple question that you would think would have a very simple answer, but sometimes we get wrapped around the axle with this one. Dr. Rod Hochman is the CEO for Providence St. Joseph Health, one of the, believe the third largest health system in the country. And he is one of the leaders that I appreciate that has the courage to state the answer to that question very simply. At number 4, we have Rod Hochman answering the question of who owns the medical record. I apologize in advance. The audio was a little rough on this video. I wanted to cover one last topic, and that's data with you. And there's a handful of ways I want to talk about this. You've talked about the power of data in healthcare and how it can have a meaningful impact on outcomes and many other things. We really have a ton of data within healthcare already. So let's talk about ownership of that data, scope of that data, and privacy. So let's start with the first question, which is who do you think owns the medical record, or who should own the medical record, and how will that change the way we view data and use data moving forward?
So I think ultimately individuals need to be in control of their own data. I mean, I think that's almost a given. The question is, who do they give proxy to and who do they trust? And unfortunately, we've had some bad examples out in the social media venue. You know, I think in healthcare, we've always considered the sanctity of data, and we're regulated to do that. So we protect that incredibly well. So what I hope is that I want individuals to have control over their data, but I hope they will trust their health organization to be that trusted partner with them to then figure out how that data gets used and where it gets used. And I would not be as afraid to say, just trust me, to some of the other organizations out there that are now trying to accumulate data on folks. I just think that one of the advantages that we have in the sector where we are is that I think our patients and our families still trust us, and we have a relationship with them. So that's the way I would see that working. And then the question is how do we use that data for our patients' benefit, but also kind of advance how we do care, and in a way that as you know, we're a 501c3, we're a publicly traded company. Our interest is the health of our patients and communities, but we see ourselves being able to use that data to advance that, not necessarily against shareholder value.
There you have it. Simple answer. Data is there to serve the patient, not necessarily to build shareholder value. Really appreciate Rod Hochman coming on the show.